We are discussing a case of a younger female patient, a 45-year-old patient who had been diagnosed with severe aortic regurgitation. And prior to the surgery, at the Rabin Medical Center where I'm from, we've performed a coronary angiogram, which was supposed to basically rule out coronary disease and approve the surgery. The fascinating situation was, of course very dramatic, was that she had an ostial left main disease, which was occlusive, and as soon as we injected the contrast, the patient crashed. We were in a situation of CPR, cardiogenic shock, had to operate. Of course, having aortic regurgitation, there are very limited situations where you can use mechanical support to support her hemodynamically, of course, and so we've had to do everything during CPR, and luckily the patient had received 2 stents and was discharged. Now the question is, what is the cause of such a situation of a patient who is a young female already having severe valvular disease and left main coronary artery disease? I should also mention that her right coronary artery was occluded as well. We have looked at it and performed CT, which demonstrated wide thickening of the aorta as well, of the vessel wall, and we have seen inflammatory markers, all of this to suggest some vasculitis. And in fact, the patient was diagnosed as having Takayasu disease. And so the conclusion is obvious that in patients, first of all, always be ready for the worst and be prepared. But the second thing is that Takayasu is something that you need to consider. Although rare in younger female patients, especially from Asia, one should think of that when having severe ostial coronary artery disease, as well as aortic regurgitation, which appears in up to 25% of these patients. So happy ending in this case, and hopefully next time we'll think about Takayasu and treat accordingly.